Clive Ramathibele Smith, a behavioral economist and chief investment officer. Clivera Consulting joins us now to discuss the spike in the COVID-19 cases in South Africa and the newest restrictions announced by President Ramaphosa. Good to have you on Newsday, Clive.
Thank you very much. Thanks for having me at this very difficult time.
Yeah, very difficult indeed. South Africa has become the first country in Africa to hit the 1 million COVID-19 cases mark. That's not good news for South Africa, of course, like you said, difficult times. What's responsible, Clive, for this spike?
You know, there was a great meme, as I'm sure you and our colleagues there always watch, what's happening in social media. And it went round virally yesterday of somebody saying, South Africans just don't listen. I mean, we were given steady, strong advice about the pandemic. We did relatively well in the beginning of the pandemic, right from the month of March when we did the hard lockdown level 5. But it seems like since we've gotten to level 1, people have really just truly let down their guard. And what has happened is we've just seen this rampant behavior of disregard of the precautionary measures that people have to take. We've seen parties, we've seen drinking and driving increase. We've seen people just not behaving anywhere near what they should be doing under the circumstances. And that, for me, is this behavior, this letting down of your guard. And the fact that nobody's wearing their masks and there's no social distancing, and those things have seriously impacted South Africans, and rightfully so, because it is a festive season. This is the time when a lot of South Africans want to celebrate. Unfortunately, it comes with dire circumstances.
Okay, well, you say South Africans just don't listen, but some would say it's a global phenomena because a lot of people seem to be suffering from lockdown fatigue, as they put it. But I just want to find out, when we say South Africans let down their guard, was their guard ever up in the first place? What was the, adoption of right behavior like, even in the times when the numbers were down? Was it that people were adopting the right behavior because they were being policed or because they understood the implications?
Well, that's a very good question, Marcis, and I think that's one that I think if I look at the statistics and I look at the numbers, if you look at what the movement restrictions did right from the lockdown level 5, which started on the 25th of March this year, and right through until the middle of July, in actual fact, the infection rate was drastically low. We managed to take it down from when it was at its peak in the second week of April, right down to its lowest in the middle of July, meaning that we're actually doing relatively well in terms of controlling the spread of the virus. And then what happened is when we moved to level 3 and level 2, although there were restrictions, we started to see a little bit of movement, people going across. Obviously, we opened borders as well in level 1. That sort of also created a little bit of more of a relaxing environment. But what I picked up, and this is from personal and both personal and also in a business professional aspect, we started to see people just not wearing masks, and people were just not doing it. You go to a shopping center, people were putting their masks in their pockets, people were putting their masks below their nose or even below their mouths. So it was sort of like a convenience to show that you have a mask just as a point of entry as opposed to protection from getting infection. So I think the behavior, yes, you talk about the fatigue, and I think we've seen that in both the US and the UK as well. But here it was even worse when we got to level 1, because I think people just felt that the disease does not exist at all. And bear in mind, there were also some very high political individuals who made comments that seemed to be carrying a propaganda sleigh of words that meant that, this was some sort of a westernized ideology to try and control people. And they were talking about that and talking about the vaccine as well, and very anti-vaccination. So all those things and the conspiracy theories that came after it created a little bit of a lethargic response from the South African population.
What is government doing to change this narrative, Clive, that you just painted now? And I was listening to the President Ramaphosa a while ago talk about implementing 5 key prevention measures. What's going to be different this time around?
I think it was the first time we saw the president actually being this emotional. It's unfortunate in your clip you didn't show it, but he actually went teary when he explained how difficult it has been for him and his cabinet to try and implement these measures, these 5 key points that are needingly supposed to assist people to keep themselves safe. And we've seen, we saw him actually, getting very emotional and almost teary to a point where he was talking about family members that this country have lost. We've reached 1 million infections. We've had 27,000 deaths. And the capacity of our hospitals is just not there. The hospitals cannot handle it. And by the way, when I say hospitals, I include even the extended measures that the government had taken to try and take the load off from the state and private hospitals. That in itself was also not ready. So the government this time is trying to say, well, we warned you that if you don't behave, this is what's going to happen. And by going back to an adjusted level 3, what they're then sending a message to South Africans is that we tried to keep you as responsible as possible. Now we're going to actually prosecute you if you do not wear your mask. That's how serious this particular shift is. We're actually going to be prosecuted. If you're not wearing a mask, if you seem not to be wearing a mask anywhere when you're in a public space, you will be prosecuted. You will be spending either 6 months in jail or even a financial fine. So those are the measures now that they've been implemented that were not there even before.
Yeah, 6 months in jail, that's tough love, if ever we heard of it. Could you help me with this? It's slightly tangential, but I noticed that there's a ban on alcohol, and that came up in the earlier. What's the connection? Is it that the alcohol makes people more relaxed, or what is it?
You know, it's hard for me to say this because you are my African brother and sister, so I'm sure you know South Africans and their booze. I mean, it's you can't put the two apart. And so this was a personal one because I'm a big fan of beer. And when the president said, listen, we're actually going to cut out the alcohol, which was very difficult, by the way, for the first lockdown to bear with, because it was just as immediate as he has made it right now. So what we have seen, and this is obviously economically trying to look at the trends, what has happened in hospitals in increasing the pressure that you see in emergency responses, is that the consumption of alcohol does have a direct and indirect contribution to the number of people that flock up at the hospitals. But not only that, it also has an indirect impact on how people behave, because it seems like people just behave much more relaxed, but also do very irresponsible things, such as not wearing your mask, such as not doing social distancing and keeping that 1.5 meters away. And so those things have contributed to the high infection rate that we've seen over the last 2.5 weeks. By the way, for the first time, we hit 12,500 new infections in less than 36 hours. That is a lesson that we should do.
Clive,
And you know, we have things called after.
Clive, thank you so much. In fact, I was going to ask about that alcohol. I couldn't understand it, but you have explained it, and that's quite interesting how South Africans indeed love alcohol. Thank you so much, Clive, for your interesting analysis here on Newsday.